Los Angeles County, 10 people are getting sick with COVID every single minute.
Earlier this year, LA County was the epicenter of the winter COVID surge.
Hospitals in this area say they're preparing to ration care.
Ready? 1, 2, go.
In East LA, LA County USC Medical Center was regularly seeing more COVID patients than any other hospital in the region.
I'm sorry to meet you this way.
Okay, coming in.
Nobody deserves to die alone.
Okay, here's your mom.
And we allow family members to see their relative before they pass.
I'm so I love her.
Because that's the truth of COVID. There's some that's gonna win, there's some that's gonna lose.
COVID exposed long-standing inequities in America.
We are now getting a look at data that reveals racial disparities in medical outcomes.
And turned a spotlight on the hospitals that serve low-income, working-class communities like East LA.
It's a huge problem, not just in the Latino community, but also in the Black community.
This is a story about those hospitals, largely government-funded, whose primary mission is to care for the poor and uninsured. They're called safety net hospitals.
Why are safety nets hit the hardest? Because our patients are vulnerable. We serve a community of working poor. We serve people who are working essential jobs. Buenos días, señor. Homeless patients, patients with mental illness, substance abuse, addiction disorder. We are expected to care for the patients the other hospitals won't care for.
More than 70 million Americans rely on Medicaid, and roughly 30 million have no insurance at all. But at a time when safety nets have never been more needed, they're in crisis, and it turns out have been for years.
Community leaders plan a protest tomorrow, hoping to stop the planned closing of Westlake
from
Hospital.
Hahnemann University Hospital that it too will cease operation.
A demonstration was held tonight for the hospital that mostly serves Black, Latino, and low-income people.
I think we're on the brink of a precipice. Even before the pandemic, many of these hospitals were losing money, and the pandemic is only going to make that worse.
Over the past year, Frontline and NPR have been trying to understand why safety nets have been struggling so much, while other hospitals have been doing so well.
You know, HCA, one of the first and biggest hospital systems in the country, posted a $3.8 billion profit last year, also during COVID. What do you think is going on there?
It is a little unfathomable to me how a hospital system could be making a huge profit in the middle of a COVID pandemic, but honestly, nothing surprises me anymore. The system itself makes no sense, and when you have a system that makes no sense, there are going to be some winners and there are going to be some losers. Is that how you want your healthcare to be delivered?